Hi, everyone. Good afternoon and welcome. Thank you so much for joining us. Welcome to today's San Bernardino County Medical Society webinar presentation, How to Talk to Patients About COVID-19 and Vaccines, a Provider's Guide. Really quickly before we get started, I just want to express our sadness for the school shootings and all the other recent shootings. I know our hearts are all broken over this sequence of events, and that we stand together with the victims and the families. So thank you all for what you do every day, because you are the antidote to this. So anyway, welcome. Glad you're here with us. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. This webinar is the first in a series of 7 that the Medical Society will be hosting between now and next spring, made possible through a grant from San Bernardino County Department of Public Health, which we very much appreciate. We are super excited that we're partnering with This Is Our Shot and vaccination in today's presentation, and we do want to thank them for all the work and collaboration that has gone into this. And I don't know if Dr. Sanchez is on the line with us quite yet, but I did want to introduce Dr. Javier Sanchez, MD, our incoming SBCMS president of our board, as well as one of the founding members of This Is Our Shot and vaccination. And he was also involved in coordinating this and leading us to our wonderful speaker for today. Before I introduce that amazing presenter, I do want to remind you all that you're welcome to submit any questions either via the chat feature on your Zoom dashboard screen, or when Dr. Correa has finished speaking, you can click the raise hand icon on the dashboard and ask your question that way. And we will get to you either way, so you can make a comment or ask a question. And of course, if you're not speaking, thank you so much for keeping your sound on mute. So with that, I'm very honored to introduce today's presenter, Ricardo Correa, MD. He's a key force in the This Is Our Shot and vaccination national campaigns, which, as you all know, arose from the early stages of the pandemic as a culturally sensitive way to bring equity to patients in the context of getting vaccinated and fighting COVID misinformation. Dr. Correa is an associate professor of medicine and is the program director for Endocrinology, Diabetes, and Metabolism Fellowship, and the director for diversity in graduate medical education at the University of Arizona College of Medicine, staff clinician and researcher at Phoenix V.A.M.C, and faculty at Mayo School of Medicine. Sorry, Dr. Correa. Mayo School of Medicine, Mayo Clinic, Arizona. He's an editorial board and associate editor of more than 10 scientific peer-reviewed journals. His research focuses on healthcare disparities in diabetes and obesity in the Latinx population, cardiovascular outcomes in the transgender population, and adrenal disorders. Dr. Correa is nationally recognized for his leadership in promoting underrepresented minorities in medicine. He was trained in clinical epidemiology and tropical disease and has been active teaching about COVID-19 and vaccines. So we are very, very lucky to have him with us today. Welcome, Dr. Correa, and I will turn it over to you.
Thank you so much for the invitation. Thank you, Alison and Janice and Steria, because it's a real pleasure for me to be here. And let me share my screen so we can start. Where's this? Okay. Screen. Okay, so today it's a real pleasure that San Bernardino County Medical Society is doing this series of lectures, because it's so important to learn about how to talk to COVID to patients and what about the vaccines. So this is mainly how we should approach this. And really, as Alison mentioned, this is a conjunction collaboration of This Is Our Shot and vaccination and PGP. So, as you know, I'm an endocrinologist by training, and I have been focusing during this time to help our Latino community doing multiple areas, including diabetes, obesity, and in the last 2 years, basically on COVID-19. So This is a partnership between the San Bernardino County Medical Society, and this is our shop at Vacunate Ya. And let me just give you basic information that this webinar will provide to all of you. So about COVID-19 and vaccines rates in California, how to explain the facts to patients and example scenarios with facts-based responses, and finally an evidence-based methodology where how to communicate with patients about COVID-19 and vaccination. So there was a grassroots organization that started approximately 1.5 years ago. We were lucky to have your upcoming president of the board, Dr. Sanchez, as part of the leading person having this effort in the English part and also in the Spanish part. So the mission of This Is Our Shot and Vacunate Ya is to be the nation premier digital grassroots coalition of health heroes by providing accurate health information, promoting effective health policy, and building trust in science. And our mission as an organization is to build healthier communities by elevating trust voice of healthcare heroes. Of course, this was originated initially for COVID-19, but our projection is that it will help in the future. And a great shout out to Janice that is here too, because she has been the person that have been having leading all of this and giving us the perspective and all the support to make this thing to survive what is have survived. So thank you so much for all your support. So let's start talking about certain facts about COVID-19 vaccination. One of the things is that we know that up to now, 11.5 billion people that represent approximately 60% of the world population has been vaccinated. So we want that at this point, more people get vaccinated, but 65% is the majority of the world has been vaccinated. So COVID vaccine has been widely given now for almost 1.5 or 18 months now, since December of 2021. We have known that the immunity that is coming from the vaccine is higher than the immunity that is coming from the having COVID. So this means that the response rate after the vaccination is much better than just getting the infection. The vaccine do not protect to all of the COVID vaccines infection, but the studies were done to protect for severe hospitalization, severe disease and death. And that is what we have found in the data that about the vaccine. Also, the vaccine all protects for the Omicron variant. Now the Omicron B2 variant, that is the one that is 58% of the population in the US have it. And definitely the vaccines protects other at home. Vaccinating people are less likely to transmit their infection, including the Omicron variant, to others. And this at the beginning was not so well understood, but in 2021 and in the middle, it was understood that yes, not only protect you to get severe or hospitalization, but protects the transmission of the disease. What about some other facts about the COVID-19 vaccination? So the study have shown that immunity from vaccination, as I mentioned, are superior than the ones coming from the infection. That the vaccine protects other at home. Sorry, this is just a duplicated one. But let me show you a little bit of what is happening with the cases in California. So from April 2025 to May 1st of the 2020, April 25, 2022 to May 1st, we have seen the trend that have been seen in the past, that 4.9 times more people that are unvaccinated are likely to get a COVID-19 vaccine. And you can see that in red. So there was a big peak at the beginning were unvaccinated compared with vaccinated people, were having more cases. Then, if you remember, in the period after Omicron variant start decreasing the infection rate, then also in the three groups, there were a decrease always, but it's always seen that there was a little bit more contamination in patients that were not vaccinated. And now what we're seeing in the last 2 months is that, again, that rate of infection is increasing, but it's increasing not in the people that are vaccinated, even the first time vaccinated, meaning the 2 first dose, but also in people that get the booster, but it's different from the ones that are not vaccinated. So the rate of infection is increasing, most likely, as we expected, as last year. Summer and winter are the 2 peaks of this disease. So most likely this, if we don't do anything, this will continue to trend up and go to a peak during the summer. So we know from the beginning that there was a first set of vaccination. Pfizer and Moderna were 2, Johnson & Johnson was 1. And then there was some research on how long this protects our body. And this came to a position that after 6 to 8 months, the antibodies again start decreasing, not to the point of 0, but start decreasing. So there was a recommendation of having a booster vaccine, in this case, the 3rd dose. So booster vaccine is important because, as I mentioned, the antibodies decrease during the period of time that is approximately 6 months. Booster vaccines, what they do is that they create more strengthen the memory of the sorry for that, create more the memory of the immune system, so you have more antibodies production. And definitely the CDC say that all adults that have been fully vaccinated for 6 months, as this recommendation, they should get the Moderna vaccine. If you get the Pfizer after 5 months, and then Johnson & Johnson after 2 months, you should get the 3rd booster or the 3rd dose. The 4th booster is a little bit yet not for everybody. For people more than 50 years old is recommended. For people more than 12 years old that have some immune system compromise, then it's recommended. But really those that are not in the middle is still not recommended. So this is very important to understand that, and to talk to the patients, that it's not only having the first 2 doses or the first set of vaccines that definitely protects, but with time that memory is getting lost. So we need to just get more stimulus to that to our body, and that's why the boosters are recommended. Most likely the 4th dose booster will be recommended for everybody soon. These are some of the cartoons that between TIOS and Vacunate Ya has been produced to get to your patients, so they can understand some of the roles of the vaccines and all that. For example, in the left side in the cartoon, this is mainly when you should get tested. And we have seen that there is a decrease on testing, even though now we're increasing on infection rate. And it's because what is happening is that in the media and in the social media, the amount of information that we were getting, positive or negative, but what we were getting was a lot in 2020 and 2021, and now has started decreasing. So people are start to feel relaxed and thinking that this pandemic has disappeared, and this is not true. So we have to continue with the same effort because we are not at the end of the tunnel. So having this conversation with your patients on when you're feeling sick, when to get tested, and how to report those testing to the counties, the departments, so they can take into account. I see many of the patients say, oh yes, I did a home testing and I came positive, but I didn't report to anyone. So those cases that are being reported as per yesterday, 110,000 people in the US, probably you can multiply that by 4. And that will be the real number, because not everybody is being reported to the different counties so they can go to the CDC at the end. And in the right side, you can see basically when to do the COVID vaccine if you are vaccinated, and give you more explanation on how vaccines and COVID works. So we really have no limit in a person that have not been, if it was just a mild infection, you can get the COVID vaccine few days later after your symptoms disappear. So those concepts in the past that we have to wait 28 days or 3 months, that's not true anymore, unless you receive some kind of therapy that prevents you to that, or you are immunocompromised. What happened with pregnant women? So there is a lot of studies that have been done in this area, mainly because of the misinformation and disinformation about infertility, about having some DNA affection, and then that the offspring will come with some abnormalities. So definitely, we know that women that are vaccinated during pregnancy is safe and effective. The vaccine is safe and effective. We know that getting the vaccine protect the woman that have from getting COVID. At the beginning of the infection, we had so many pregnant patients that were very complicated with COVID-19. So having the vaccine protect them with that. And there has not been any evidence on pregnancy and infertility related with the COVID-19 vaccine. The American College of Obstetrics and Gynecologists published a very well done study where they didn't find any relationship between the COVID-19 vaccines and pregnancy or its relationship. So definitely other things that we know is that women that are pregnant and then deliver, during the breastfeeding, all those antibodies, the first 6 months of the baby get it protected too. And we really don't have vaccines for kids less than 5. So that's a way of protecting the babies during that time. So if we look at the real world studies, more than 200,000 females has been vaccinated when they were pregnant, and there have not been any concern or side effects or any major damage to the offspring or to the woman. So we know that as we talk about the vaccination, in the antibodies produced during the vaccination is transmitted to the kid through the breast milk. And what is indicating is to complete your 2 doses of the mRNA vaccine while you are pregnant, to prevent any complication of pregnancy, but also to prevent hospitalizations and death in pregnant women. How to address vaccine hesitancy, and this is probably the most common thing that we as providers need to address many times with our patients. So we know that there is a lot of emotion, belief, value, narrative, all of this that the patient comes with, a lot of them coming from the social media, other times from bad search of the good information. So there is sometimes from families that think that they have experience with this, and really there is minimal experience. Nobody in the Latino community a lot of the times is because grandma told me about this, and really that's not true. But the hesitancy is based on fear of the safety and efficacy, and we're going to talk a little bit about that. Is based on what is herd immunity, distrust on how the government does all of this, views of different political parties, and then desire to maintain a sense of freedom when we have proved for many years, not for the COVID-19 vaccine, but for many years that vaccines has been effective and have been able to eliminate a lot of the viral infections that we have over time, and one of them being smallpox, that was a deadly, at the beginning, a deadly virus. So first of all, and then at the end, I will talk a little bit of the methodology that we try to use, but definitely you cannot come to a person and just start as a defensive person and bombard that person with your evidence, even you have the right. So you have to validate their concerns and see where they are coming and understand why they are thinking like this. Then you have to have an open dialogue where you present data, they can present their data, but there can be a fluent conversation. It's very important that patients have voices, even though they're not in the correct track, but they have their voices and it's their health. And at the end, if this works, then you leave the door open for more conversation, and then that probably is a time where the patient can change. But what I feel is that, yes, we are following a lot of evidence-based medicine, but patients don't understand what is evidence-based medicine. We understand what it is. We understand what is randomized controlled trial, what is science behind all of this. Patients telling that they don't understand. So if you come saying, yes, the latest study that include 200,000 people, blah, 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 the patient doesn't care about that. So that's why it's important to start the conversation of what you understand about this, what are your concerns? And then in that conversation, in that empathy that we establish as a patient-physician relationship, then we can start giving some information. And probably the first time is not the time that they will make the decision, but in the follow-ups times is when really they make the decision. So what happened in children? So the CDC recommends at this point that every kid more than 5 years old get vaccinated. And right now they recommend that every kid that is more than 6 months away from the first dose get the booster. So this was approved just recently. The kids less than 5 years old has not yet been approved. It seems that it's been getting soon to be approved by the FDA and CDC. But not yet. So we are going to talk about 5 years and older. As I mentioned at the beginning, in the US, from the 200 million people that has been vaccinated, 20 million of them has been kids. And this is a high number. And then we have seen that these kids that in the past were having hospitalizations and death has decreased to the ones that has been vaccinated. A lot of the myth is that kids do not get infections, and that's not true. We saw a lot of kids with infections during the beginning of the pandemic and with severe infection, and some of them die. Over 4,000 children, plus the 20 million that we have participate in the 5 and 11 years old vaccines, basically studies. And the minimal amount of them suffer from one side effects, and medicine, everything is not everything is 0 or 100. We have to expect sometimes something in that range. So that is why we need to have a understanding that if one person develop, it doesn't mean that it's the bad vaccines. If it happened with acetaminophen or Tylenol, there is some people that take Tylenol, but there is some people that develop a fulminant liver failure just by taking Tylenol. This is not common, but this can happen. What are the concerns that usually patients comes to ask us about it? As well, the adverse effect of the vaccine almost always happen within 6 weeks of receiving the vaccine. And this is to a certain point correct. Majority of the patients that get the vaccine has mild symptoms from all of you know, from just the fatigue to the fever, to the muscle pain in the first 24 to 48 hours, and then it disappears. So mainly the majority of them, the side effects disappear very fast. What are the long-term effects of having the COVID vaccine? And as up to now, we cannot talk about 5 or 10 years because the vaccine has been given for 18 months. But up to now, the people that have the vaccine and the ones that participate in the trials, that we can make it 2.5 years or 2 years and 3 months. Trials starting March 2020, we have seen that there is no long-term complication on those patients compared with what we see in long-term COVID patients that got the infection and they have been having some chronic complications, not the same thing as the vaccine. And families are worried about the long terms, that the vaccine is safe. A lot of things have to be done with the kids. If this will cause, as I mentioned, fertility problems of all of this. There's a study that shows that sperm count and ovary maturation has not been affected at all by the COVID-19 vaccine. Different with some reports of cases that, yes, there have been some report of cases when you get the natural infection, you can get some of these side effects, even in the reproductive system. So the breakout through were higher in those prior to the disease versus those that are vaccinated. Definitely, this is something that is important to understand. So now when we have the breakout vaccinations, we have it in places where there are more unvaccinated people than in places where there are more vaccinated people. There was a period of time when the myocarditis was higher in patients with COVID infection. Really, it was a minimal amount, and all of the patients that have myocarditis, mainly adolescents, males that have myocarditis, recover. And as I mentioned, not everything is 100 or 0%. There was a side effects, but when you analyze all the data of the 12.5 billion people that have get it, then you get a number that is very, very low. And as we know, nothing is 100%. So there is a probability that if you take the vaccine, and this happened with the flu shot and all of that, you can get the infection. But what the vaccine does is to protect hospitalizations and death. And that's what we have seen. Yes, you can hear some stories that there are people that have been vaccinated and get hospitalized. That, as I mentioned, the vaccine effectiveness is 92–93%. So there is some percentage, but minimal percentage, but the benefit outweigh the risk. So 12 million of children has become ill with COVID-19 vaccines. So those that say, oh, the COVID-19 do not affect children, so that's not true. So we can see that from those 12 million, 3 out of 10 didn't have any comorbidities. They were not kids that were sick, that they have chronic conditions. But what was impactful was that 9 out of 10 were unvaccinated. So if you see, a lot of the kids that got the infection after the vaccine was approved by kids were unvaccinated, and from those, 2 out of 10 went to the ICU. So we are talking about a very safety vaccine where the percentage of side effects is less than 0.001%, but the percentage of infection in patients that are not vaccinated, mainly kids, is 90%. So you see when you weight the risk of so in California, there has been 920 cases reported up to now of what we call multi-system inflammatory syndrome after the infection, none of them after the vaccine. And the COVID-19 vaccine is, as I mentioned, 91% effective against MIS-C. So very, very important to understand, again, the benefit outweighed the risk in the vaccination. Another concern that I've heard is the infertility issue. And basically, there is no study that have shown not even decrease in spermatozoids or decrease in the ovule function. There is biologically very difficult to happen because the mRNA vaccine is an mRNA. So the mRNA do not enter the DNA and will not cause genetic modifications. Basically, many of this study has done in pregnant women, and then the pregnant women have not shown to have any side effects, and definitely has been safe for those group of population. Another concern, it is better to get immunity from the disease. And this is because our mentality from other viruses is coming to place here. And what we have seen is that patients that have the COVID-19 infection, some of them develop immunity for long-term, other will develop immunity for very short term. So you never know in which group you are. So the immunity from the virus, from the native virus will not cause you really, we don't know in which group you are, so we don't know how much immunity you will get. Definitely, we have seen breakout through disease in vaccinated people. But if you look at those breakthrough cases, majority of them has been very mild, like a common cold or some symptoms like that, or even asymptomatic. There is few report of cases in those breakthrough cases that has been hospitalized. So the vaccine is as effective as it can. And definitely the recommendation is that even if you get the COVID-19 vaccine, because we don't know, because we are not following the antibodies on those patients, but we are following the antibodies on the patient that enroll in the randomized control trial for the vaccine, and we know how they are, and this is a group of multicentric studies. The recommendation is that you get COVID-19 vaccines, you should get also the COVID-19 infection, you should get the vaccine. So look at this table and see who the people trust more when they have to talk about COVID-19 vaccine. And it's clear that the patients trust more their own doctors. Their own doctors or healthcare providers, they are the ones that trust more. And this trust is decreased through the organizations and the state governments and officials. So this is what I always tell. This is what I always tell the people, is that for us, the mentioning CDC, FDA, Dr. Fauci, because we are involved in the medical world, it's very important, and we really have a big trust. If this survey was done in scientific and medical population, then definitely the numbers would be different. But for the patient, they don't know who is Dr. Fauci. They don't know who is the CDC or the FDA. They have heard about that. They will trust in that community healthcare provider, in that person that is dealing with them with other chronic conditions, in that person that they see walking in the same grocery store that them. So that's why we have to focus not on the message that the big authorities give, but on the message that you as a healthcare provider give to your patients, because that is the thing that changed. And the experience here in Arizona was that at the beginning in the Latinx community, we didn't see a change even though there was the vaccine approved. But when we start in our community clinic giving the vaccine, the rate of vaccination improved 100%. And it was because they were the same faces that they were seeing in other times. Then we start doing a movement and say door to door. And we start knocking the doors of all the neighborhood that were surrounding the clinic, that they know that we have a clinic, community clinic there. And then people start getting the vaccination. So do not believe that really the great authorities on this are the ones that are going to make change your population. It's you and you are the authority for them. And more in the cultural environment that we live in San Bernardino County, County, you can see that a lot of the population is Latino. And the issue is that in the Latino community, who you trust, the priest and the doctor. That's how the structure of the culture is. So if your doctor is coming to you and telling you some evidence, most likely they are going to do that. And the other thing that we use here, and that I know that Dr. Sanchez is doing there, is involving the religious belief of the patient, or involving the churches, involving the where they attend or their faith, because this is how the human are structured, and then we come with that kind of culture. So these are this slide is basically to talk about language that we have to use when we talk about patients. So we really don't want to say injection or shot. It's cause a anxiety on patients, more on kids. When they say, oh, you're going to get a shot, that's you think about needles and needle trigger, even in adults, a lot of things. So it's better to use the term vaccination. The term a vaccine developed quickly. I have heard a lot of healthcare providers using this. What they come to their mind, oh, this is because the government, always conspiracy theories are so easy to believe. So the government wants to monitor me. No, we have a safe and effective vaccine. The emergency use of the vaccine and the approbation and the approval of that really is nothing that the public will understand. How is the process of approval of a vaccine? And if you start getting into the weeds of how an emergency, what is the difference between permanent and emergency approval of the FDA, they will be more complicated. So you say authorized by the FDA. Definitely saying something in negative is always not good for patients. There are things that we still don't know. That's true. But the best way to say it is, this is the latest information. It doesn't mean that you know the true, and nobody knows the true, but having that in a positive way, it's very, very important. And the other thing is that keep your country safe. I have heard a lot about this, like keep your country, keep your state safe. For the patient, they don't care about the country. They care about their family. They care about people that are close to them. So use that language to them. Do not use the word government, because government implies political parties. And if I have this belief or you have this belief, so use the term public health. Definitely scientist. Scientist for the common population is nobody. So use the term medical experts. And finally, do not try to say the anti-vaxxers or the people that are skeptical, because that will trigger some other fights that you don't want to start. So people who have questions, that's a better word that we have seen that works for this kind of things and less confrontation. So the final part is a methodology that between FIOS, Vacuna Teja, and PGP has created in a way where you can do a conversation, have a message, and finally have a post-conversation step. So we call 3-5-3 because there's 3 initial steps to start the conversation, 5 key messages that you should give to the patient, and 3 follow-ups message that you should add to the patient. So how we start a conversation? As I mentioned at the beginning, always is good to listen. The same thing that we do in the clinic with a patient. The first thing is to ask, what is happening? Where are you coming from? How do you feel? What are your concerns? And then you can start saying your things. But asking this make the patient feel that they can share with you experiences, that they can share with you things, and that you are not coming with a stone and it's going to throw that stone on it. And I see this in my diabetic patients. I see this in my obese patient that suffer from obesity, sorry. I see this on them. And this is the same thing that we should do on COVID. Listen, hear their concern, what they are feeling. So that's the first thing. The second thing is create an alignment of safety. So you can have some empathy and say, oh, I understand, and I will be scared too. We want to both be in the safe place. And I remember many of these steps. This is nothing, we didn't create a wheel with this methodology. This is something that we learned in the first year of medical school. Many of you remember something called nurse, and nurse is trying to create that empathy. What is, can you tell me about your feeling? And then you create some empathy. I understand how you're feeling. I want to do the best for you, and thank you for coming. So this kind of methodology is the same thing that we are doing here. Asking for what are, asking and listen, create that safety environment, and finally find common goals. If you feel that the patient goal is like, hey, we want all of our kid goes to school, or we want that everybody is without mask, or that we want that there is more safely among the loved one, find that common goal, and that will be the start of your conversation. So do not come with your own bias and your predisposition that you have the right, but come from the other side of trying to listen what are their concern, and then with that listening you can create your own specific message that you are going to give to the patient. Then that's the three. Next, what are the 5 key messages that we need to give to the patients? The first one is that the vaccines will keep you safe. We know up to now that from the 11.5 billion people that have been vaccinated across the world, less than 0.0001% of them have suffered from any side effect. So that's why we have to demonstrate that that the vaccine is safe, that the vaccine side effects, yes, appear in some population, but it's the majority of the time is safe, and we have not seen big complication besides few case reports. But of course, as all of we know, those case reports make it to the media. Those are the case reports that make it to the social media, and not the other 100 of people that do not get anything. So that's why having that it's important. The second message is that yes, we have some common side effects, and these common side effects will last for 24 to 48 hours, and that you will feel some of these kind of things, mainly body ache, fatigue, tiredness, and redness in the area, pain in the area where they vaccinate you, but that will disappear. Sometimes I tell the patients that yes, if that is a side effect of just having the vaccine, that really is not the complete virus. Imagine the side effects of having the complete virus. Then the effectiveness of the vaccine. And one of the things that I always tell the patient is that compare how many people were hospitalized in 2020 to how many people are hospitalized in 2021 and now in 2022. And you can see that even though we have increased rate of contamination, and this is increasing, the amount of people hospitalized is the same in these 3 years. And what is the difference between these 3 years? Is the vaccine that appeared at the end of 2020, and then the amount of people that have been vaccinated in 2021. So yes, we are increasing. We have patients in the hospital, most likely unvaccinated, but we have been seeing that really the vaccine protects against hospitalizations and death. The fourth point is that really the vaccine was built more than 20 years ago. Really in the 1994, this was the first time that there was a study published about mRNA vaccines. And when this is basically for the mRNA vaccines, it was first created by a German scientist that then was followed by the NIH. And I remember I did my training at the NIH when the Ebola came in 2014. they were testing, at that time, Dr. Fauci was not so famous as now, but I remember Dr. Fauci in the NIH rounds saying that they were testing the mRNA vaccine again in this Ebola virus. But of course, it didn't progress the disease so much. The virus is very effective in that case that it kills people. So it's very ineffective because it kills people. The virus, what they want to do is just to reproduce. So Ebola was very ineffective virus. So really the vaccine was not needed. It was controlled before, but this is nothing new. The only thing that was new in the last 2 or 3 years that we have been testing the vaccine basically has been adding that new part of the SARS-CoV-2 to the vaccine. But this is nothing new. It was not created in 2 years. It was not created, sorry, in 1 year. It was not created in 1 year. It was a technology that was used for almost 30 years. It was used in SARS-CoV-1 too, and we had that. So really, that's something that the patient need to understand, that many of the work at the beginning was done between Germany and US, and then US follow, and most likely the scientists that did the work in mRNA vaccines are going to get soon the Nobel Prize in medicine and physiology and medicine. And finally, the last message is always end with you have a question. So I'm glad that you want to know more. If you have a question, the ultimate choice is yours. Always leave the decision to the patient, and then definitely talk to your doctors, guide the patient where they can find more information if the patient wants to, because at least you plant a seed of something on the patient. So these are some of the places that you can go. For example, you go to vaccine.gov and put your zip code. They will tell you where are the vaccines. If you go to the webpage of this is our show of Vacunate Ya, they will tell you what is the information about the vaccine. And if you go to the webpage of the San Bernardino County Medical Society, you will find information about how to explain to your patients and where in that county you can find all of this. Finally, is what happened after that conversation, like the follow-up. First, acknowledge the personal choice. Remember, health in anything, like in COVID, as we did in diabetes and we did in other things, is that the health is from the patient and the patient needs to make their own decisions. You are there to be a guide, a mentor, a coach for them. Always keep the line of communication open. Even if the patient comes with belief or things that you disagree, try to not get mad. Try to take a deep breath and then keep the line of communication open, because if you close it, that's the end. Probably you are the last person that the patient is asking. And if they feel that you are coming back to them, it's not good. So keep the open communication and offer other places where they can take more look if they want to do it. If they can take a look at the as I mentioned, where they can find free vaccines or where they can find more information. And I can tell you that using this 3-5-3 techniques not only helped you for the COVID vaccine, but has helped me. For example, you have in endocrinology, we see a lot of osteoporotic patients that always comes with a lot of myths and belief with the treatment of osteoporosis. But if you use this 3-5-3, I have seen find out that also for other things like in osteoporosis, helped me a lot to convince the patient that this is the treatment for the medication, even though there is some bad press of some of the medications that we use there. So in summarize, really there is three first steps to start the conversation. You need to convey 5 messages that start with the safety of the vaccine, with the efficacy of the vaccine, the effectiveness of the vaccine, with the side effects of the vaccine, that the vaccine has been a long time and always have a question so that you can answer to them. And finally, the follow-up, never close the door, I think is the most important thing. And let the patient make the decision. But when you explain to them in their own culture and their own language, you will see that things will be different. So if you have any more questions, this is the webpage and social media of the campaign. This is our showdown Vacunate Ya. So you will find there a lot of things, and we are more than happy to solve any problems. As I mentioned, your county society has been the leader in the Hispanic community Vacunate Ya organization. So you will find a lot of resources that in San Bernardino County Medical Society. So thank you so much, and I open now for questions.
That was fantastic, Dr. Correa. Thank you, and thank you for enabling us to be able to communicate so well with our providers, who can in turn communicate with their patients here in the San Bernardino and Southern California area. We really appreciate it. I don't see too many questions, but I have one. So I entered it in the chat, but I have one. With regard to boosters, I know we hear from time to time from either other professionals or sometimes other physicians who say that, well, before we do this blanket approach to not so much vaccinations, but maybe boosters, we should be testing antibody levels in individuals to assess the need. And I'm sure logistically and expense-wise, that's an impossibility. But as far as if this could be done ideally, is that an effective approach, or do you think that's not really a necessary thing? What's your view on that?
Yeah, it's I heard that a lot, like why we should be testing the antibodies and then see if it, so really being in an ideal world where everybody will be able to test for antibodies, that will be a good approach. And then if the antibody testing costs $1, I think that it will be feasible. But in the world that we live, where the antibody testing are very expensive, and the data that have shown in all of these follow-up studies that probably is a randomized, so it's a controlled trial. It's not reality, but it's a controlled trial. And we have seen how on those population, the antibody has decreased. It's better just to extrapolate to the real world. I will never recommend a patient to spend hundreds of dollars on testing the antibodies. And I feel that some of them, when you have the insurance and you have the money to do it, well, it's your insurance and your money. But when you don't have that, then it's better just to follow the studies that have shown that after 6 months, it starts decreasing the antibodies. Doesn't mean that goes to zero, because even in those patients that only got the first vaccine, they are protected. But because you don't want any risk, it's better just to get the booster vaccine. But just to go to your question, in the ideal world that we don't live, yes, it will be the best option. In the world that we live, no, it's following the recommendations.
That makes a lot of sense. Thank you so much. Anyone else have anything you want to add, or raise your hand? Dr. Sanchez, anything you want to?
I will. First of all, thank you, Allison. Thank you, Janice, and thank you to the rest of the San Bernardino Medical Society staff for putting this together. This is fantastic information, and I want to thank Dr. Correa, who has been a leader in the last 2.5 years when it comes to the vaccine. He has been a great proponent of fighting misinformation and disinformation, especially in the Latinx community, whether he does it through lecturing with us here, through the AMA, through the Arizona Medical Society, on Univision or Telemundo, or any of the other areas that he's been giving out this message. Has been it's been an honor working with him. It's been great. He's a great resource, and I'm so glad that we were able to get him here. And also, like he mentioned, we have a lot of resources here, here with San Bernardino County Medical Society, and with This Is Our Shot and Vacunate Ya. So please utilize that. Reach out to us if you have any other questions. We're more than happy to partner with any of you if you want to go to talk to either your local community or your local hospitals or your local medical group. we're more than happy to share all this information with you and partner with you to bring this important information to you.
Thank you so
Fantastic.
much, Dr. Sanchez.
Thanks, Dr. Sanchez. That we certainly agree with you on all of that. Thank you. We have Dr. Lane. Dr. Ken Lane has a comment. No? Okay. Joseph Lee, you have a couple of comments or questions.
Yeah, this is Joseph. I'm one of the nephrologists in Riverside, 40-some years, and for the serve as a president of the Riverside County Medical Association, chief of staff at Riverside Community Hospital. I just have two comments. One is I am currently working with the UC Irvine vaccine R&D. I think the issue, the trouble, by the way, the Correa is wonderful talk. I really enjoyed your very diverse and very helpful information. The trouble is we know the antibody wax and wane over time. So the question is for the patient is, am I protected? When should I get a booster? And the doctor in charge of the UC Irvine vaccine R&D, in fact, developed methodology called microarray. In fact, just one drop blood, no drop of blood, just one drop by fingertip will detect 40 antibody, including 10 antibody against the COVID-19. So that you know exactly you have anti-MP, which is natural infection produce immunity, and also the antibody caused by the immunization. And based on our learning, we know there are different type of reaction. There are some get a shot of vaccination. There's no response, only rise antibody after second booster and so forth. So I think I'm trying to do is work with him to develop a personalized COVID management, because everybody's different, personalized COVID management. And if there's something coming up, we are doing something right now, and I'll let you know, Dr. Correa. And also we're with the Laura Green in the RCMA on this aspect too. Second comment is in one of the rare occasions, I was actually served as a renal consultant for a 360 clinic, which had done probably about 500,000 tests and detect a lot of kidney problems. So I was asked to set up CKD clinic or module for those. So I know there's a lot of long haul syndrome back in late part of 2019. So I focused on this, and I talked to City of Riverside County Riverside Public Health Department. I'm going to talk to them at the end of this month, talk to the CEO of the hospital, because there are so many people hospitalized, and we all know hospitalized patients, about half would have long haul syndrome. And we know long haul syndrome develop over time after about 6 weeks, but the virus once get infected only lasts detectable about 5-7 days. So what happened to those people and virus gone, why they still get sick? So, and I'm working with other guys on this too, because there are two receptor attack with virus, and they trigger the cascade reaction. One is called thromboxane receptor, which is called embolism and thrombosis. Second is prostaglandin D2 receptor, which is very abundant in brain, the heart, the kidney, lung. And the more antibody, the more receptor you have, more susceptible to the infection, which is very high in old people, in the diabetic, hypertension, obesity. That's why those people are very prone to get the complication for it. And there are some medication available. I'm working to get some kind of grant to do the trial on this too, so that we hopefully can do something, prevent the progression of the long haul syndrome, which occur in about 20% of the people who had the long haul syndrome. And now I think Riverside County about 600,000 COVID infection. That means you have a 180,000 long haul potentially. And then in San Bernardino County, probably similar, even maybe a little less. So it's really one pandemic is over subsiding, the other pandemic will rise. And so there are a lot of issues come up in the future. There is no way this is going to be a subside so quickly. I'm hoping there's something I can do to help the community, and I'll let you know, Correa. and also Miss Elton, but still once there's something more available. And in fact, Gilead, I'm contact them now, try to do a trial, get some funding, and I'm set up the post-pandemic long haul clinic in Riverside as well too. And hopefully, and then I share the board of one of the hospital. I know I can't disclose the name of the hospital, but I know those people hospitalized with pandemic, with COVID, there is up to about 20% more readmission, not even counting the ER visit. So that's a lot of sickness, a lot of waste resources, and a lot of costs involved with the care like that. And so I'm hoping it will get something going and help out all the at least our inland. And I look into many of the pandemic clinic or in the country, UCSF, UCLA, and Emory, and other places too in New York. But they're only a clinic to attract people who have long haul. But Dr. Correa, I'm sure you agree, long haul is a very vague symptom. Nobody knows, and there's not even defined by anybody. Also, there's suggestion. So people are scratching their head, why I don't feel better? And we know there are quite a few individuals kill themselves because those are sudden death. And the VA hospital, VA study shows there's about 8 or 9 out of 1,000 non-hospital patient of COVID will die suddenly within 6 months. And so it become a real big issue that I'm hoping there is something we can find it out and I'll share with the folks in San Bernardino County. And I'll definitely go to Dolores and try to do this for everyone.
Thank you so much, Dr. Lee, for that. Yes, definitely, as you mentioned, this is a disease that we didn't know, and we are trying to understand a little bit more, but the long-term complication is something that we need to understand, and it will be amazing if you can contact, whenever you have something, or partner with Dr. Sanchez and Allison and Janice about this, because it's really data that we need to get. I know that NIH have a lot of grant funding at this time for this type of study on long-term complication of COVID. So this is the time to get that information and then to understand a little bit more.
Yeah, in fact, the medication I mentioned about just happened to block both receptor is one of the old medications, not even patent right now, because was patent expired about 20 years ago. And in fact, used in Japan in treating allergic rhinitis for the children. So we just want to repurpose the medication in managing the COVID infection. And again, this required trial before anything can be concluded. Yeah, but it's something potentially possible. And there are a few articles published talk about this too. But trouble NIH, there are so many requests or the grant on different everything else. So it's really hard to be able to pinpoint what we try to do, get their understanding or something, but we're trying. Yeah.
Thank you.
Well, thank you so much, Dr. Lee. Yes, we certainly appreciate all your work in this area, and it's really nice for us here at San Bernardino to make your acquaintance and meet with you too. So as you know, I work closely with Dolores, so we look forward to getting updates from you.
I'll talk to Dolores, something concrete. I'll talk to Dolores, and maybe I should contact you.
Yeah, that would be fantastic.
Yeah.
Absolutely.
Right.
That sounds terrific. Well, unfortunately, everyone, we're at time to let you all go. I think a few of you have dropped, a few of you, you're not on here, but a few others have dropped off. I do really want to thank Dr. Correa so much. You were just really fantastic. That was a really balanced, clear presentation for providers, as well as I think some of the lay public as well, to approach others, in a really non-confrontational, non-defensive way. So thank you very, very much. We also want to thank, this is our shot, and Vakunate Ya, and we have Ben Ernst on the phone with us here. So Ben, thanks all in you and Sherry for all your work on this. Dr. Javier Sanchez for all your leadership in this area and getting this campaign established to begin with. We want to remind those of you who are left in a month, on June 28th, we'll have our next webinar in the series, and that's going to be about kids and COVID with Dr. Eric Ball, pediatrician with CHOC from Orange County. He will be our special guest, again, a partnership with This Is Our Shot, Vikunate Yas. So that's on our website, sbcms.org/events. We'd love for y'all to sign up for that. We'll be sending you reminders. And you know what? Enjoy your Memorial Day weekend as we observe and honor all of those who passed while in service for this country. And thank you all for what you do every day. And it was awesome to see you all. And thank you again, Dr. Correa. Okay, everybody, we'll see you in a month.